Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office. I'm Herb Simmons. You should know that by now, but I am so excited that we are rejoined by Sam Bierman today. Sam, it's good to have you back. Barb filled in for you yesterday.
Yes.
But I know you've been burning the candle still. You answering calls yesterday from me, but we appreciate you back here.
Oh, absolutely. Happy to be back.
So bring us the news.
The news. I would like to say that it's great news. I would even like to say it's good news, but we have ups and downs, and we had a little bit of a down day today, so we're hoping the next day and later this week we'll be on our way back up. But as of today, 28,474 tests have been performed for St. Clair County residents, with 3,210 positive test results, which is an increase of 72 from yesterday, and that does include both males and females from under the age of 10 up to their 90s. Our daily county positivity rate for today is 15.9%. For negatives, we are at 25,231 with 33 results that are still pending. I am happy to report that we are reporting no new deaths today, so we are still currently at 149. And there was a point brought up yesterday that there is a discrepancy between what we are reporting for St. Clair County and what IDPH is reporting. We are currently working on that to clarify the difference in those numbers. So as soon as we have that, we will bring that to you guys. For those who have completed their required IDPH 14-day quarantine, we are at 2,221. For state totals, we are at 2,348,487 that have been tested, with 165,301 positive test results, which is an increase of 1,598 from yesterday. And for deaths for the state, we are reporting 7,347, which is an increase of 23 from yesterday. For our hospitalization numbers, and these are for hospitals that are in St. Clair County, currently we have 40 patients that are admitted due to COVID-related reasons, and one of those patients is currently on a ventilator. For congregate living facilities that are in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms. For those who watched yesterday, you know that Barb said that we had no new additions, and today we only have one change to all of our long-term care facilities, so we are just going to report that one. The Caritas Family Solutions location that is in Belleville currently has 17 cases and no deaths. All of our other long-term care facilities and congregate living facilities had no change from yesterday. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. Sam, it's sure good to have you back.
Oh, thank you.
And I can see you've got a little sparkle in your eye today. You're ready to hit the ground running.
Yes.
So here we go.
Yes.
Chairman, if I could, 1 minute. Sam brought up about the discrepancies in the deaths, and I think it's worth mentioning that the state is getting numbers from all over the state of Illinois.
Correct.
We're getting ours from the local health department and the coroner's office, so you're going to find out where the discrepancy is, as you said.
Yes.
But I just want to let our followers know, because that was quite talked about last night on the page, why the discrepancies.
Sure.
And that's why we're bringing it out here. When something like that is caught, we want to get to the bottom of it.
We certainly take, not only myself, but other members of the health department that work on our stats and our numbers and our reporting. We take a lot of pride in what we provide to our residents of St. Clair County. So it is very important to us that we report accurate and correct numbers. So when we do find an error or a discrepancy, we do everything we can to figure out where that lies.
And not everyone that's treated for COVID from St. Clair County gets treated in St. Clair County.
Correct.
So that adds
Exactly.
to,
It does.
to the discrepancy.
Yes.
And there could be a delay. Somebody that's being treated in St. Louis, somewhere in Missouri or another state that lives in the county, eventually it will get caught up. It's just
Correct.
there's going to be a lag there.
Correct.
Thank you.
Okay, well, we'll move into the zip code report for today. And in 62059, we remain at 8. 62201, we went up 9 COVID positive diagnoses in that particular zip code. We're now at 164. 62203, we went up by 2 to 119. 62204, we went up by 2 to 96. 62205, we went up by 2 to 124. 62206, we went up by 1 to 282. 62207, we went up by 11 to 176. 62208, we went up by 14 to 187. 62220 went up by 6 today to 260. 62221 went up by 4 to 278. 62223 went up by 4 to 129. 62225 remained the same at 12. 62226 went up by 9 to 327. 62232 went up by 3 to 69. 62239 went up by 1 to 26. 62240 went up by 1 to 7. 62243 went up by 2 to 19. 62254 remained the same at 106, as did 62255 remain the same at 8. 62257 went up by 1 to 19. 62258 went up by 1 to 39. 62260 went up by 2 to 31. 62264 remained the same at 63. 62269 went up by 12 today to 195. And 62285 remained the same at 27. So we've seen a lot of zip codes go through the mix. A lot of them went up today. We want to make sure that we're wearing our masks, doing what we need to do so that we keep those numbers down. That's why we're here every day. And there are a lot of people out there fighting for trying to continue to do business as usual, try to get our lives normal, or as normal as they can be during these times. And schools are a big part of the questions that we're getting here, and parents are getting ready to send their kids back or decide what's going to happen with the kids this fall. And today we're joined by the newly minted superintendent of Belleville District 201, Brian Metzer.
Hi.
Brian, you just started July 1st, although you've been with District 201 and District 118 for a lot of years, so you certainly have put in your time, and congratulations.
Thank you.
On becoming superintendent, and you came in and you got to hit the ground running.
It's an interesting time.
So I guess let's just jump into this. What has the school board decided, and how did they decide what to do for this fall?
Okay. On around July the 10th, our school presented a plan to our school community, along with a survey that asked them what their intentions were for the fall. And the plan outlined about 25 different areas within the school and kind of our protocol process for those things. And then it presented 2 instructional models. The first instructional model is one that's based on an A-B type of a schedule, so that would be alternating days. Monday, Wednesday, Friday, Tuesday, Thursday, different group, Tuesday, Thursday, Monday, Wednesday, Friday. So it's essentially designed to decrease the number of students on campus on a daily basis to allow for social distancing and some of those other things that we know mitigate the spread of coronavirus. The second prong of our plan is a full remote learning. So it's an option for parents that don't feel comfortable, or they may have a student who has a specific health need or a family member in the house who has a health need. And for them, they need to stay home and be fully remote. So our results yielded about 75% of our families wanted to come back to school under that plan, and then about 25% will be in a full remote, fully kind of instructional online model.
And so how did you decide which classes you would teach online, which ones would have instructional testing in the classroom?
So we are in the process now of kind of funneling down what it is that our fully online students need. And then basically, because of our concentration of students, the majority of the courses that students want will be offered just because of the density of kids that are wanting to go fully remote. There may be a few specific situations where we have to develop or work on some kind of a one-off situation or a couple-off situation to try and fill some needs. But in general, due to the concentration of kids, we're going to be able to offer probably not our complete course catalog, but to the fullest extent possible, as many options as we can.
If a parent decides that they want to be fully online, does that student then watch what's going on in the classroom, or do they have just a separate through a Zoom process, or is it really a separate curriculum, or at least way that they're taught?
It's really a completely separate system at this point. So it will have a set of staff members assigned to those specific sets of courses and those specific curriculum delivery models. It's going to be different. It's going to be different than it was in the spring. It's going to be different than what our blended students get in their AB schedule. It's truly designed to be interactive, engaging, innovative. We have invested significant amount in technology and PD over the summer for our teachers, so they'll be ready for either phase of the teaching process.
And you've had a lot more time to prepare. You were thrown in the spring. How many days did you have to decide you were going to start teaching from home?
Well, it started to become apparent about the second week in March, about the middle of that week. And we sat down with our teacher group on March the 13th, I believe that was the Friday, and said, hey, this is coming. And in fact, we spent with that teacher group and our administration the entire weekend, Saturday and Sunday, putting a model together that said, okay, we need to be nimble. What can we do? And on Monday, we implemented that model. Wow. I would like to commend our professional staff, our teacher group. Developing plans like these where everybody feels as comfortable as they can with the end product is something that is very difficult to navigate. And our administration and our teachers did an excellent job of coming to the table willing to solve problems. Our custodial and other support staff, everyone's world has changed as a result of this, and everybody's rolled up their sleeves and said, okay, we're gonna try and do this the safest way, and we know our lives are going to be different, and we're willing to do the work that it takes. So I'm really proud of our folks.
So let's talk about, and you should be. Yeah, this is a team effort. Let's talk about some of the changes that students will see. How about technology? Are you going to be providing equipment to
Sure.
students?
So in the spring, we provided Chromebooks that we had on hand for students that needed them. Based on the amount of instruction and the quality of the instruction and the way it's going to be delivered this fall, we need every student to have a device. And so we have geared up to provide all of our students with devices. We have also geared up to provide all of our students who do not have reliable internet on their own to get it through our schools. So those students will receive mobile hotspots so that we can guarantee connectivity for everyone. And then on the instructional side, it's getting pieces of technology where teachers can do live lessons that they can record, and ways to present those lessons online that is interactive and allows them to use PowerPoints and videos and a lot of those things. So that's the other side of kind of the technology piece that we've been working on as well.
So what about when students come to school? What are some of the differences that they will see, some of the protections you're putting in place?
Well, when they arrive at school, first of all, they're going to be on a bus. If they're transported by bus, that is has a socially distant model for them to be transported. They're going to have.
What does that mean?
So basically, it means that we're going to develop a system that allows them, with a mask on, to be in excess of 6 feet from one another while they ride the bus. Wow. And so that's been an undertaking for our transportation folks. We provide transportation services for over 13,000 students in the Belleville area. So they've been working at this since March. But our students will begin by completing a health safety checklist on their device, and they will be temperature checked upon arrival in the building. When they get there, they're going to notice there's less than 50% of the capacity of our school. They're going to notice that there are hallway markings that lead to traffic patterns that mitigate times when we don't socially distance, and there's going to be hallways, stairwells that travel in certain directions in order to mitigate those things as well. Classrooms will be set up in socially distant fashion. Cafeterias will be smaller group settings, socially distanced. They will have assigned seats. Their meal more than likely will come to them. And so it's just all of those things that go into the school day to try and support the wearing of masks, social distancing, and then keeping not only our students but our staff safe as well.
So you probably have stocked up on masks and hand sanitizer and plexiglass.
I mean, we have been in the mask buying business for about the last 60 days. In our case, we're providing students with reusable masks. That helps us in a lot of areas, but it'll help us with identification of students and a lot of other things. Staff masks, plexiglass dividers for high traffic areas where somebody may need to pass a paper or they need to sit with a social worker or a counselor. So yeah, we have really signage, floor markings. I mean, it's one of those situations where we have an individual, and most of his time is spent procuring all of those things. Right now, we're working on masks that have a clear spot in them, so that when we have students that are learning specific speech things or language or have hearing loss, that they can still get communication from their teacher with a mask on.
Wow. Have you color-coded the masks for Belleville East?
We have.
Blue and...
We have Belleville East, Belleville West. In
Wow.
fact, they will have a student identifier on each one, because starting a new year, there are new kids and they've grown since March, and so this will allow us to help also identify the kids.
So CARES Act money helped you pay for a lot of these things?
It did. So CARES Act really assisted us in a variety of ways. It will assist us with all of those kind of instructional pieces that we're putting in place, the purchasing of Chromebooks, those pieces of technology. It will help us with masks and all of those items that really we need. I do think that the initial allotment of money will be utilized this year as things change. You know, we're learning very quickly that there are some things that are here today and gone tomorrow in terms of expectations, and so we're trying to stay ahead of those things too.
And this all can change if we would see a major change in the health patterns in the state?
It could change tonight. It could change tonight. You know, I think one of the things that we have stressed with our folks is, based on our current set of conditions and our current circumstances, this is what we feel is a safe way to provide the best experience for our kids. If those conditions change, then that situation may change. You know, we do have mechanisms in place that if those conditions change, that we shift to an all online delivery of curriculum. You know, we are hopeful that all of the measures that we put in place will help us be safe and provide that experience for kids as well that school does. But if there are health circumstances or issues that are community-wide that we need to make sure that we watch, we'll make changes as we need to.
How about sports?
Sports is the great unknown at this point. I know there's a lot of talk out there right now about sports. I am anticipating that we will get answers in the next couple of days on what's going to happen with athletics. Our schools have been very conservative in their workouts. We're currently only working out outside. We are socially distanced. We're dividing kids up into groups. We are not having any contact. And so, those things, our approach has been very conservative. You know, I think there will be answers for us, specifically as it pertains to high impact contact sports.
How about choir? I would think there is no...
Yeah, I mean, we do have some folks working on remote choir courses. We also have some ways, because we can reduce class sizes potentially, to go outside during vocal time and socially distance and get ourselves organized in a fashion that makes that safer. And so, yeah, there are a lot of those things. I met with our band folks this morning and our physical education folks, and a lot of those kind of, as we move through the curriculum pieces and the pieces of the day, how do we make this piece safe?
Where do you point your trombone so it doesn't blow on anybody else?
Or is there something we can put on the end of the trombone that mitigates any particulate matter that's leaving it? Those are discussions that we had today.
Well, you guys are drilling down on details if you're talking about trombones.
Trying our best.
Well, we appreciate you coming today. Herb, do you have anything?
Yeah, quite a few questions are coming in as our followers, and we don't mean to put you on the hot spot, but
We'll try our best.
we always get the hard questions from our Team St. Clair followers. One of them came in case of a reported case of a COVID, whether it be a student or staff members, what kind of procedures is in place?
So one of the things that I think we did the correct way was we developed our plan in direct conjunction with ISBE guidelines, Illinois Department of Public Health guidelines, and in almost constant communication with St. Clair County Department of Public Health. So when we looked at models that may have been something like every kid every day, in our situation with the density of kids and how they were in the classroom, it required a significantly different way of handling a positive case because we were unable to ensure social distancing among children. So my short answer is when we have a positive case, or if we have a positive case, number one, we're going to communicate with St. Clair County Health Department. We are going to be able to drill down on, we were able to maintain social distancing with this child in these classrooms, which changes the way then we respond to that. It may be a situation where we inform those students in close proximity and the educators that were in closer proximity. It may be a simple symptom check for those folks instead of, if they were not, obviously the response is far different. So yeah, that is our plan, is obviously to try and ensure that social distancing piece, which helps us, and then obviously be in communication with the health department to get further direction in terms of specific responses, and then communicate appropriately to those that need to know. We want to be as transparent as we can be under the confines of the health nature of things, but we also want to make sure that people understand we're going to be honest.
Good. Well, one question came in from Aaron. It says, just asking for clarification. So teachers are still exposed 5 days a week, and parents are locked into a decision they made 2 weeks ago before the numbers started increasing again. She's just needing clarification on that.
So I will say this. So our survey ended for parents. We took our last set of results on Sunday evening, just this last Sunday. So it has been fairly recent that we gathered that data. However, with that being said, for parents that elect the blended model where kids are at school, and there is a situation that arises, we will have the ability to allow that student to transfer to a fully remote setting. With that being said, those students that elect a fully remote setting will be in that full remote setting for the entire semester.
They can't hop back.
They're not at that point, and the reasoning behind that is the system will work on an equilibrium that is, we're going to try and socially distance. We're going to try and make sure we have this set up in these areas, and that amount of change could put that system at risk. So that's the reason why you can leave the blended setting to go full remote, but if you choose full remote, you are doing that for the semester.
Okay, good. And Brian, there's a couple other questions coming in. You got there?
Yes, sir. One is, have you done any type of simulations with your teachers playing roles of students to try and ensure that distancing and the way the classroom transitions would work?
We have not at this point. We have done a fairly thorough amount of walkthroughs in terms of, here is how this amount of square footage works in this classroom, and here is how. We're going to also attempt to maintain as many desks in a classroom as we can, and that may seem counterintuitive to fewer students, but that will allow us to socially distance kids and perhaps not have the same students in the same desks every hour. So you may use a desk every third hour to that point. But At this point, our teacher leader group, we've been working through those pieces of the plan. I foresee that as something that's coming, but it's not something we've currently done.
If a student would have to quarantine for any reason, does that mean then that they would be online then the whole rest of the semester, or would they be allowed to come back into the school setting after the quarantine period was over, or whatever the issue was that they were quarantining for?
So our plan for students like that have a medical reason for leaving for a period of 10 days, we would provide remote instruction to them during that time. When they were healthy and cleared to come back to school, they could.
Okay.
Last one that came in, you kind of touched base on it already, but about will students be changing classes during the day, and if so, how would it be disinfecting classrooms and desks in between classes?
So students will be moving from class to class. It is in our plan that we presented to parents. So our plan is we've invested in electrostatic disinfecting machines for our classrooms. However, it is not feasible to do it between every classroom in every hour. So our goal is to take all of our high traffic areas and do those hourly. Things like stairwells, handrails, doorknobs, restrooms, all of those high traffic areas. And then obviously our goal is in our midday periods to hit open classrooms. We have, the way our schedule works, we do have some areas where we have a variety of classes open during specific hours, and those classes will be done at that time and then in the evening time. So our goal being, if we can find a way to keep enough desks in the room, you may only have a desk used every third hour. If the classroom's open hour is fourth hour, we can clean it, and then we can start over again with 1, 2, 3 in terms of those desks being used. That is our current plan.
And you're pumping a lot more fresh air into your heating and cooling system.
We are. So we have worked together. We do have several staff members. One of them is one of our teacher leaders who is very astute in this area, and we've been working with the folks that tune our HVAC systems to try and increase, in fact, double in this case, the amount of outside air that we're introducing to the buildings.
So Brian, also, this has got to be a nightmare, and that's lightly putting it. Your staff, the teachers, what is the pulse of the staff? It's a challenge, I know.
Well, I will tell you this. First of all, administratively, I've never seen our folks work harder. They're hard workers, but I've never seen them work harder. They're not people who are asking why or saying, no, we can't. This is a difficult model. I'm extremely proud of them. Our Board of Education has supported us from the beginning. Our teachers, we started this, like I said, in early March with our discussions, and they've been professional. They've come to the table. They've represented their folks well. They want to do what's best. They want to do what's safe. I can't say enough. I'm humbled by both groups. But I will also say our transportation folks are working really hard, and our administrative assistants and our teacher assistants and our custodial staff. Everybody's life has changed. And, we want to do what's best. And honestly, I think our culture shows that. And our teachers, specifically our instructional staff, they've rolled their sleeves up.
So as you sit here today, one of the other questions came in, do you feel that this is safe to send the kids to school?
Yes. So I have students in school of my own. Now I'm not in high school at this point. I did last year, but I don't this year. And I feel like schools are trying their very best and going to do their very best to try and keep our kids safe. I do. I feel like we're going to do it.
Good. Brian, you had one other one?
You have one other one that came in that says, will there be procedures in place if you have a student that refuses to wear a face covering?
So this is one of our commonly asked questions, right? What happens if a student doesn't do that? One of the things about a mask mandate, in my opinion, is that is a public health statement. And in our case, if a student refuses, not a student that may have some type of a medical exemption that we need an adaptation for, but a student who refuses to wear a mask, That student is violating a public health order. They're creating an unsafe learning environment for others, and we will say to that student that you will need to learn remotely. We owe them a quality education, but we also have to have integrity in terms of the way we implement the system, because we got to keep everybody healthy. So,
Well, good. We appreciate that information, and I think it's really been informative today, don't you, Chairman?
I do. You know, you're in a spot where you have to educate these kids have to get on with their lives. They can't postpone education for a year and stay home, and they need a quality education so they can move on and go to college or do whatever in life. They need freshman, sophomore, junior, and senior level classes to get through that, and you're doing that. I'm very impressed today. I sure appreciate
thank
you
you.
being
I
here.
appreciate you too.
Thank you.
Appreciate that. Well, Chairman, I know when we said we wanted to start planning for the return to school, and what a better way to kick off with having Brian here. And tomorrow we'll have Mr. Culliver from East St. Louis District 189 will come in and give us their plan that they've got in place, and we'll fill out the week with other superintendents and school officials. But I want to talk a little bit about the rate that the state has got us under the 8. I called you this morning and said we were at whatever it was we posted, Brian, 6.6, and they come out a couple hours later, and as of the 18th, we're at 6.9. My point there is we're not out of the woods. We want to stay underneath that 8%, or otherwise we're going backwards. I mean, that's the only blunt way to put it. Am I right?
You know, it's pretty clear. The state is looking at us. They're looking at all of Southern Illinois and the numbers. And a number of our county and a number of the surrounding counties all are seeing increases. And so wear that mask, wash those hands, keep that social distance in mind, and we can get through this. But as we see these numbers go up and down, we're living these numbers, because if we have to start shutting things down, I'm afraid that it's going to be far more difficult the second time around to get reopened.
Well, and I want our followers to understand, because we posted today on our page that, you know, they caught up with finally their updates, and then 2 hours later they come out with their other metrics. They changed it to the 19th. As of the 19th, we're at 6.9, and that's what we're looking at regionally. And as the chairman says, we don't want to go backwards, and the way we do that is the 3 W's. You know, wear the mask. As I told you the other day, if you sit at home and think about how many hours out of the day you got to wear that mask, you would be surprised to know that it's a very little time. And wash your hands and watch the social distancing. That's the only way we're going to do that. I got a call this afternoon from the director of IEMA. She's concerned, wanting to know what the IEMA can do to help get these numbers under control, and she's sending one of her representatives down from her office next week. We're going to brainstorm a little bit, so we continue to do what we have to do here, but we're all in this together. You can't change it, and we're going to be talking with the mayors tomorrow, because it doesn't do good for one community to say, okay, we're going to enforce this way, but then the neighboring communities aren't doing that. And our mayors, our city leaders have been very good at supporting this, because they know how serious it is. So we're going to be talking with them tomorrow. But you individuals who are sitting out here following us every day at 3:30 need to be telling every member of your family, your neighbors. Don't go over and knock on their doors unless you got your mask on. Call them on the phone, put it on social media, that be part of the solution, not the problem. We're going to be back here shortly with Daisy and Cindy to translate this into our Spanish communities, and then we'll be back here tomorrow afternoon with new numbers, hopefully a little bit better news, and we'll see you tomorrow afternoon. Thank you.